So that's our first trial, which is giving patients 7 days of preoperative tamoxifen. Why tamoxifen? Because we didn't want to exclude premenopausal women before their surgery, and this is for early stage breast cancer, stage 1 and 2. And then they get 14 days post-operatively. Well, why do they get that? Well, we wanted to parallel our study to the POETIC trial that Mitch Dowsett is doing in the UK, and they're doing 14 days of post-operative. They're doing 14 days of preoperative AI and then 14 days of post-operative AI. They're looking at long-term recurrence and things like that. So a different endpoint, but we thought, well, we better do that 14 days. And I I emailed with Mitch, and I said, why are you doing that 14 days post-operatively? Because, I mean, is there data to support that? And he said, no, but most of our investigators felt that doing surgery is immunosuppressive, and the patient ought to get a 14-day window post-operatively to kind of counteract that immunosuppression or protect them. So we thought, well, we'll do it because there's really not much downside. And we're going great guns with that study. We'll enroll our 40th out of 54 patients intended this week. And so we've been able to enroll on it very well. It's an easy one to sell patients on. We're really only looking at, is there a change in their Ki-67 from the pre-op, from their original biopsy to the one we take in the operating room. The medicine is exceedingly well tolerated for those 21 days. Some of our secondary outcomes are going to be to look at symptoms and whether or not those predict symptoms long term. And of course, we're going to follow these patients for 18 months, even though our primary outcome is at, just the post-operative, the operative specimen. But we want to see if maybe we can detect a little change in people who are going to be compliant. Now, we're not telling them anything, but I feel like if they have this chance to try on the medicine perioperatively and they realize it's not as bad as they might have read about, then that might make them more willing to go on it later.